Do you have a heart condition? Could you become pregnant? What do you need to know? Any pregnancy carries a small risk of problems or complications for the mother or baby. In most cases, this risk is very low, but the presence of a heart condition can increase the chance of problems during pregnancy, delivery, or after the pregnancy. Pregnancy is considered high risk in a small number of cases. For a very small number of women with a heart condition, the advice may be to avoid becoming pregnant. People with a heart condition should speak to their healthcare professional to see what pregnancy could mean for them. This is called preconception counselling. What does preconception counselling involve? Preconception counselling is a discussion with a healthcare professional with knowledge of heart disease and pregnancy. In most cases, this will be a straightforward discussion, particularly if you have a mild or minor heart condition. You may require further tests such as an ECG, heart tracing, echocardiogram, heart scan, or exercise test to assess the risk of complications. This will also help to decide whether any further treatment is required to reduce the risk of pregnancy. You may be advised to address other factors such as stopping smoking or weight loss, which can help reduce the risk to you and the baby. It is advised that women with a heart condition avoid an unplanned pregnancy. This gives you time to have this discussion with your healthcare professional about pregnancy and any risk there may be. Your potential risk in pregnancy is dependent on a few factors: your diagnosed cardiac condition, your ventricular function, the pumping chambers of the heart, any leaky, thickened or mechanical heart valves, your symptoms before pregnancy, any heart rhythm problems you have had or continue to have, your oxygen levels, medication you are prescribed, and other medical conditions and lifestyle factors. Who should you ask for more information? You can ask your GP, practice nurse, cardiology nurse, pharmacist, cardiologist, midwife or obstetrician. They may refer you to a specialist for preconception counselling. If you're considering the use of assisted conception services or fertility services, please ensure they contact your cardiologist for advice about your heart condition before starting any treatment. Should you stop taking any medication before or during a pregnancy? Do not stop any medication unless you have been advised to do so by your specialist healthcare team. Many prescribed medications are safe in pregnancy, but some can be harmful to the baby. This should be discussed before a pregnancy. Where can you find out about contraception? You can ask your GP, practice nurse, midwife, specialist nurse, pharmacist, cardiologist or obstetrician. Some forms of contraception may be unsuitable in certain heart conditions. In general, long-acting reversible contraceptives such as the progesterone injection, implant or coil are safe, reliable and well tolerated. If you think you might be pregnant, what should you do? If you have a heart condition, you should tell your midwife as soon as possible, because your pregnancy may need to be monitored by a specialist team at the hospital. If you're not sure if you want to continue your pregnancy, you should get advice as early as possible from your healthcare team. Emergency contraception can be used up to 5 days following unprotected sex. Where else can you get advice? Further resources are available from the Scottish Obstetric Cardiology Network at www.socn.scot.nhs.uk.